So today I'd like to start anatomy mock for MRCS OSCE, as well as one station from skill part, that is which may be postoperative anastomotic leg. Who'd like to join for anatomy mock? Ashik,
Hello,
can you
can
hear
you
me?
listen me? Yes,
Yeah.
yes, yes.
Okay. Do you want to start anatomy mock?
Okay.
Okay. Can you please introduce yourself a little bit for the audience?
Okay, I'm Dr. Ashik Mridha from Bangladesh, and I'm working as a registrar in the surgery department of Dhaka National Medical Hospital.
Okay, thank you. So I'm putting a timer for 10 minutes, 1 minute for Canadian instruction and 9 minutes for your performance.
Okay.
And I'm going to share my screen. Then we can start. Okay. Can you see the timer?
Yes.
Okay. So let's start. Upper limb anatomy. Can you see my screen?
Yes, you can see.
Okay. So your time should start from now, because I'll ask you some more question. Is that okay?
Yes, it's okay.
Okay. Thank you so much. So can you able to see the picture, the brachial plexus?
Yes.
Okay.
Yes, sure.
Can you identify number 18?
Yes, the number 18 is musculocutaneous nerve.
Musculocutaneous nerve. Thank you. Can you please identify number 8?
Number 8 is the lateral root of the median nerve.
Thank you. Can you please identify number 16?
It is the medial root of the median nerve.
Number 26.
Number 26 is the number 26, right? It is a ulnar nerve.
Thank you. Number 4.
Number 4 is the deltoid muscle.
Thank you. So can you please tell me how brachial plexus form?
Brachial plexus is formed by the anterior rami of the cervical 5 to thoracic 1 nerve root.
Okay, thank you. So can you please tell me the different parts that may be found in different region of the body of the brachial plexus, like where the roots
Okay.
can be found, or trunk division?
Yes, the root found in the it exit from the interventricular foramen in between the scalenus anteriorus and medius muscle. Then the trunk, which is situated at the base of the posterior triangle of the neck, and it is behind the third part of the subclavian artery. And the division is situated on behind the middle part of the clavicle, and the port is related to the second part of the axillary artery.
Thank you so much. So do you know what is arc paralysis?
Yes, it is the injury of the upper roots of the brachial plexus, cervical 5 and 6.
Okay. Can you please tell me the deformities from due to arc paralysis?
Yes, it occurs to the vegetative deformities, where is the occurs like the arm is adducted and internally rotated, and the forearm is extended and pronated, where the muscle are involved, where is the paralysis, there is the supraspinatus and the deltoid, infraspinatus, and that it is minor muscle, and the biceps brachialis and brachioradialis muscle. And there is a sensory nerve supply, sensory loss into the of the radial side of the arm and forearm.
Okay, thank you so much. So, can you able to see the picture?
Yes.
So, can you please tell me the name of this artery?
This is the axillary artery.
Okay, can you please tell me the branches of axillary artery?
Yes, the axillary artery, it has three part, whereas the branches, first branches is the superior thoracic artery. Then the second branches is the three artery, whereas that is the mm, uh, thoracoacromion artery, lateral thoracic artery, and the subscapular artery, and anterior and posterior circumflex humeral artery.
Okay, how this axillary artery divided into three parts?
It divided by the pectoralis minor muscle.
Thank you so much. So, can you able to see the picture?
Yes.
Can you please identify number 29?
Number 29 is superficial palmar arch.
Okay. Can you please tell me the number 30?
Number 30 is the superficial palmar branches of the radial artery.
Thank you so much. Can you see the picture?
Yes.
Can you please tell me the number 1?
Number 1 is acromion.
Number 4?
It's the clavicle.
Number 9?
Number 9 is a supraspinatus muscle.
What is the function of that muscle?
Supraspinatus muscle, it is a part of the rotatory cuff muscle, whereas the function is the initiator of the abductor of the arm up to 15 degree, and it also causes external rotation of the arm.
Okay, can you please identify the 5, number 5?
Number 5 is a deltoid muscle.
Which nerve supply this muscle?
It's supplied by the axillary nerve.
And the axillary nerve comes from which cord?
The axillary nerve comes from the posterior cord of the brachial plexus.
Thank you so much. Can you able to see the picture?
Yes.
Can you able to see the picture?
Yes, sure.
Okay. Can you please tell me the number 1? What is number 1?
Number 1 is the axillary nerve.
Okay. Apart from deltoid, which muscle supplied by axillary nerve?
It's a teres minor muscle.
And what is number 6?
The number 6 is the lateral head of the trapezius muscle. Sorry, triceps muscle.
It's actually it's not muscle. It's a vessel.
Number 6. Sorry, number 6. It is a posterior circumflex humeral artery.
Okay. Number 10.
Number 10 is teres major muscle.
Number 11.
Number 11 is the teres minor muscle.
Number 14.
14 is the long head of the triceps muscle.
13.
13 is the lateral head of the triceps muscle.
Which nerve supply triceps?
It's a radial nerve.
Thank you. So, can you please identify number 7?
Number 7 is the frontal teres muscle.
Number 9.
Number 9 is flexor carpi radialis.
Number 4.
Number 4 is the brachial artery.
Number 12.
Number 12 is the median nerve.
Okay, thank you. So, can you please identify pisiform bones and base of first metacarpal bones from here?
First metacarpal first metacarpal bone is the 19, which is a scaphoid, and the
Base of
pisiform is 15 number.
base of
Sorry.
first metacarpal. Base of first metacarpal.
Okay. Base of first metacarpal is 1,
Okay. And
and
pisiform
pisiform
bone?
is 15 number. Number 15.
Thank you so much. Okay. Can you please identify number 2?
Number 2 is extensor hallucis longus. Sorry, extensor pollicis longus.
Okay. Number 11.
Number 11 is extensor pollicis brevis.
Number 12.
Number 12 is extensor pollicis longus.
So you say number 2 is extensor pollicis longus.
No, the number 2 is extensor pollicis brevis.
Okay. So your time is finished, but I'm continue to ask you few more questions. Is that okay?
Yeah, sure. Yes, sure.
And number 10.
The number 10 is, yes, the number 10 is extensor digitorum.
And number 9.
I think I just confused. Number 9 is the extensor digitorum, and number 10 is extensor indicis.
Number 10 is extensor indicis, and number 9?
9 is extensor digitorum.
Okay. Okay. So the next, please identify median nerve and ulnar nerve from this picture.
Here is the 16 number is the median nerve, and sorry, the 16 number is median nerve, and 25 is the 25 is the median nerve, and 16 is the ulnar nerve.
So 16 is ulnar nerve, 25 is median nerve. Okay.
Yes.
Okay. Can you please tell me the supply area of median nerve?
Median nerve, it has a motor and sensory supply. The motor supply is the lateral 2 lumbricords, and the opponent pollicis, the abductor pollicis brevis, extensor and flexor pollicis brevis. And the sensory supply of the median nerve is the lateral 2/3 of the palmar surface, and the 3.5 fingers of the hand, and also there is a dorsum lateral 2/3 of the thumb, index, and the middle finger, except the tip of the fingers.
Okay, thank you so much. That's all for this station. Let's go from the very beginning. Very good for this station, and it's actually beyond 80% your performance, and
Thank you.
identify most of the structure like brachial plexus and axillary artery. This area, that's really good. But here, remember number 7. Number 7 is common flexor origin. It's medial epicondyle. So common flexor origin from here. And number 9 is actually pronator teres muscle. So cubital fossa. So pronator teres muscle is come from this medial side. That's the first point. Secondly, you know that. So for this figure, so it's quite confused for each and every candidate, because nowadays they're going to put these types of figure. So the candidate most of the time confused between 9 and 10. So it did quite good because 9 is extensor digitorum and
Yes.
10 is extensor indicis.
Indices.
That's the confusion. And number 2 is abductor pollicis longus.
Abductor pollicis longus. Okay.
Longus. Number 11 is extensor pollicis brevis. You told that. You know, this is the anatomical snub box and the boundaries of anatomical snub box.
Yes. Yes.
And here, you see, this is the marker. This is the medial side. So when
Yes.
you put your hand in anatomical points, in medial side, the nerve is ulnar nerve. So here, medial side, it should be ulnar nerve. 25.
Oh, yes.
16, it should be median nerve.
Median nerve, right?
And median nerve is related to the thenar muscle.
Thenar muscle, right?
To thenar muscle.
I just confused with that the vessel 23. I think it is a radial artery.
Okay, no problem. So remember the thumb. If they if
the indicator,
indication
yes, the
from
indicator.
here or nothing, just remember the thumb and this
Yes.
muscle, so that you can easily identify this. Okay, don't confuse with these vessels. Okay.
Yes.
So that's all for this anatomy station. So I think this preparation is quite good. Thank you so much for your participation. I'm going to stop sharing my screen. And there's the feedback. Are you happy with this feedback?
Yeah, sure. I have my little confusion. It will be clear right now.
Thank you so much for your participation.